Okay, good afternoon, everyone, and thank you for being here. We want to give the latest updates on the Rhode Island Bridge data breach and the actions that we are taking to address the cybersecurity breach. So we have identified approximately 650,000 individuals who we will believe have been impacted by this breach. In January, each of these individuals will receive a letter in the mail that explains how to access free credit monitoring. In the meantime, we continue to ask everyone to take steps to protect your personal information and your credit. And this includes protecting the minor children in your household. Most minors do not have a credit history unless their guardians have co-signed for bank accounts or credit cards. However, if a criminal has yours and your child's personal identifiable information, they could still impersonate the guardian and initiate credit in your child's name. To protect against this, apply for free credit monitoring for all the minors in your household now. Each of the 3 credit bureaus have dedicated pages to protecting children's credit, and they are a great resource to go to. And also, don't forget to go to cyberattack.ri.gov for the latest updated information. So the good news at the moment is that Deloitte and the state IT are making progress in getting Rhode Island bridges securely up and running. However, that work won't be finished by January 1, which is an important date for some programs and services. First of all, I want to let you know that if you are enrolled in SNAP or temporary assistance for needy families, your January funds should show up on your EBT card without a problem. For these programs and for Medicaid, there is no need to worry that your benefits will be terminated. There will be no terminations while the system is still down. For HealthSource Rhode Island, however, customers who have not yet chosen their insurance plan for January do have new action steps to take. And with that, I'll have Director Lang give you the information on what steps you should be taking. Director?
Good afternoon. My name is Lindsay Lang, and I'm the Director at HealthSource RI, our state-based marketplace for affordable health insurance. I know this is a very busy season, and it's hard to find extra time to take the important steps we've outlined to protect your personal and sensitive information. We are urging everyone to go to the website cyberattack.ri.gov today and follow the 5 steps the experts recommend to protect your personal information. As many now know, our system has been down since Friday, December 13th, due to the cybersecurity incident involving Deloitte, the vendor who manages that system. I want to offer some information to Rhode Islanders who are wondering what this means for their health insurance through HealthSource RI. The bottom line is that we have you covered. If you have questions, concerns, or you need to take steps to set up your health insurance for the new year, we are here for you. We are extending our contact center hours for the next few weeks. I also want to share some specific guidance for HealthSource RI customers about how to make sure you're all set for the coming year. We are extending our open enrollment through February 28th so that once the RI Bridges system is back up and running, customers have time to choose the coverage for the year ahead and even get it backdated to January 1st, 2025. If you're concerned about having active health insurance on January 1st, For example, if you or someone in your household has a critical prescription medication or other important medical need, we will help you get coverage that starts on the 1st of the year. If you need to have coverage for the 1st of January, please call HealthSource RI's call center. We will be ready to take those calls starting noon this upcoming Thursday, December 26th. And I'm going to give you that phone number. 1-855-840-4774. We will help you enroll in coverage directly through Blue Cross Blue Shield of Rhode Island or Neighborhood Health Plan of Rhode Island with a January 1st coverage start date. Again, you'll be able to enroll directly with active coverage starting January 1st. You will not be responsible for premiums while you're temporarily enrolled in this program directly with the carrier. And our carriers are also working to limit out-of-pocket costs that customers will face in the months of January and February, like copays and deductibles. Once our system is back up and running again, we will help you apply through HealthSource RI, and that's important to ensure that you're receiving any federal financial assistance that you would qualify under normal circumstances. I'm going to run through this direct enrollment program once again. While our system is down, we have a temporary program to ensure that Rhode Islanders with an urgent need for health coverage starting on January 1st are able to enroll through either of our 2 health insurance carriers, Neighborhood Health Plan of Rhode Island or Blue Cross Blue Shield of Rhode Island. For the months of January and February, those enrolled in this direct option will not be responsible for premiums, and carriers are working to limit out-of-pocket costs like copays and deductibles that you incur during that time. Again, it's really important to note that once our system is back up and running, we're going to encourage customers to come through HealthSource RI and ensure that you have affordable health insurance set up for the remainder of the year. We'll help you enroll and make sure you're accessing whatever financial assistance is available to you at that time. So what do you need to do? We're standing up a dedicated webpage with this information at healthsourceri.com/covered2025. It will be available later this afternoon. We'll be ready to take your calls and connect you with this option, again starting at noon this upcoming Thursday, the 26th. We'll walk you through your options and help you understand what's available to you and how it will work. Then we can help you enroll online through the carrier of your choice. Again, those options are with Neighborhood Health Plan and Blue Cross Blue Shield of Rhode Island. We're normally open from 8 a.m. to 6 p.m. Monday through Friday and 9 to 12 on Saturday mornings. And we're working to extend those hours, so please check back on our website later this week for updates about our call center and walk-in center availability. We know that the majority of our customers are already in our carrier systems, so I do want to talk about that briefly. Most of our customers were auto-renewed or actively chose a plan already before the system went down on the 13th. If they haven't already, these customers should make a payment by the end of the year. You can do that at any standalone CVS location. You can do that by calling HealthSource RI, or you can drop off a payment at our call center. Further, we've been working with our carrier partners to ensure that any existing 2024 customer who is not already renewed are temporarily kept in their existing health insurance plans. And once the system becomes available, those customers will be able to make any plan selection that they like for the remainder of 2025. I also want to remind customers that the health insurance card you have right now for coverage through December of 2024 still works. The cyber incident and its effects to the system do not affect your current coverage for this month. Finally, I want to acknowledge our health insurance carriers, Neighborhood Health Plan and Blue Cross Blue Shield of Rhode Island, for their partnership as we pivot for the time being to support customers through this direct enrollment program. They have each shown incredible dedication. They have very hardworking teams who've been working with us side by side in coordination over the last couple of days to make this work. and we greatly appreciate their partnership. So in closing, I just want to make sure that HealthSource RI customers and anyone who is looking to enroll for 2025 knows that we're here for them. You can call us starting at noon this upcoming Thursday to learn more about that direct enrollment program. And once again, our open enrollment period has been extended through February 28th of 2025. Thank you.
Kim,
I'm up.
you're up.
Good afternoon, Kim Brito, Director of the Department of Human Services. I just want to take a few moments to review how we are sustaining benefits and service coordination to our impacted customers and those in Rhode Island. So DHS remains committed to ensuring that Rhode Islanders retain access to critical benefits during this time. We secured federal waivers, enhanced communication strategies, and proactive adjustments. DHS is continuing to deliver essential services while working towards full system restoration. Based on our work to date, including system testing, DHS is prepared to distribute all scheduled benefits for the first of the year on time and through normal distribution channels. I am pleased to report that the first week of operations went very well. Customer service was highly organized with limited wait times in both our offices and our call center line. Paper processing was implemented successfully. Much like HSRI, Medicaid, and the Office of Healthy Aging, DHS spent considerable time communicating with community partners who play a key role in supporting our customers in the community, where they live, where they do their business, and day-to-day activities. I would like to thank them for their partnership during this time. As the governor mentioned, there will be no terminations in December. So DHS is confirming that no benefits will be terminated in December, ensuring uninterrupted support for all of programs, including our Supplemental Nutrition Assistance Program, child care, general public assistance, Medicaid, and Rhode Island Works, which is our TANF cash assistance program. Our manual processes are in place to address pending applications, recertifications, and reported changes to ensure benefits are maintained through the end of this year. Those who currently have an appeal pending should know that hearings will continue in January, and benefits that are in place right now will remain sustained in place until your hearing decision is completed. Thank you.
Questions about what we've heard? Okay, Patrick?
The governor, you said there's progress being made on getting the system back up and running, but not by January. Given the reports that you've gotten, progress that is happening, when do you think the system will be back up and running?
Well, we expect in January, but I'll let Brian give you the details on that.
Thank you, Governor. We are driving towards a January restoration of the full RI Bridges environment. That requires some testing, obviously, and ensuring that the system will be stable and secure upon restoration.
And then one follow-up, I think it was a week ago or 2 weeks ago, the governor, you said you were expecting it, I think likely that data would be released publicly from the hack. Has that, I guess, one, has that happened? Doesn't sound like it. Has that happened? And if not, why not?
Excellent question. We have no indications or reports from Deloitte that the information has been released on the dark web. I think it's important to remember that the data has been taken already, and just because the bad actors are saying they have not released it doesn't mean that this information is not already on the dark web. Deloitte is in contact with the threat actor, and we're not in a position to answer that at this point.
Maybe for the government now, more than half the state where you guys will need to be impacted, and they should receive a letter by January. Are we talking January 1st, the end of the month, when in January? And people know.
Well, it'll be mailed out in January, the earliest date possible, and then based on the delivery time, they should be receiving it before the end of the month.
So my question is, we're seeing on the dark web a bit of a moving target in terms of the date that information might be released here. Why are we seeing this move around so much?
Well, I'll let Brian kind of answer the details, but remember, we're dealing with, cybersecurity criminals right now, so we have to make sure that we take that into consideration with anything that we hear from them, right?
Have you guys been negotiating with them?
We have not been in contact with the threat actor. That's Deloitte's role in this investigation. And to the governor's point, they're financially motivated. So whatever tactics they're using, we can't begin to explain.
Have you guys asked Deloitte to pay these hackers?
Again, Deloitte is managing that engagement.
First, we have a backup data, that we have a backup data of everything that we had to say. We lost information, we rely on Deloitte to get it back.
Well, I'll let Brian again answer that question directly, but we shut down the system to protect the data. So I'll let Brian kind of fill in the blanks.
Yeah. Thank you, Governor. We do have backups of the data that was copied by the bad actors, and we have full DR capabilities for the Bridges system, disaster recovery capabilities.
Why you don't use a new computer system? You use a backup data to get in touch with the people. You need to have Deloitte to restore the data.
Deloitte is contractually obligated to make sure that the Rhode Island Bridges system is operating on our behalf, and we're taking every action that we can to ensure that that system is securely restored, directing Deloitte every step of the way.
Governor, the community, we speak Spanish, Creole, Italian, French, Portuguese. Are you going to outreach all those communities in the next few weeks?
Well, again, we go to the cyberalert.ri.gov, that there's multiple languages that the information is spelled out in, so we think that's really important. The letters that will be sent out will be in 3 languages. One will be Spanish and Portuguese and English. So we're making every effort to get out. We have a full community team that's coming out of my office to make sure that it can be deployed and dispatched to any area in the state that needs it to get further explanations. So thanks for asking that question.